Welcome to The Explainer. Now, if you are focused on truly optimizing your long-term health, you are in the exact right place today, because we're going to tackle a really profound medical paradox. Think about it. Millions of people wake up every single morning, take their blood pressure pills faithfully, and they get perfectly controlled numbers on their monitor at their next checkup. And yet, they still end up in the emergency room with a massive cardiovascular event, like a stroke. I mean, the number looked completely fine, the doctor said keep it up, the prescription was filled, but the stroke happened anyway. So, how exactly does that happen?
Well, let's dive right into this mystery. Why on earth do these catastrophic events occur when the numbers on the machine are seemingly perfect? The answer is both simple and, honestly, pretty deeply unsettling. The medication was essentially just controlling a reading on a machine, but it wasn't actually repairing the underlying cellular damage that was quietly occurring inside the body.
Think about this through the lens of a car engine. Imagine your check engine light suddenly comes on. Instead of actually taking it to a mechanic, you just reach under the dashboard and, snip, cut the wire to the light. The light goes off. You pull out of the driveway thinking, great, problem solved. But the engine itself is still totally broken and getting worse by the day. You just can't see the warning anymore. That is exactly what a lot of standard blood pressure treatment is doing right now. It completely silences the warning light while the cellular damage just quietly progresses in the background. So today we are going to pop the hood and look at the actual engine.
Here's our roadmap to solving this cellular mystery together. We'll start by unpacking the blood pressure illusion, then we'll explore the invisible artery lining, look into the missing magnesium epidemic, and the stress vessel connection, before wrapping it all up with a concrete, biology-backed 4-step prepare protocol.
All right, kicking things off with Section 1, the blood pressure illusion. We really need to rethink the water pressure.
Now, the sheer scale of this issue is just staggering. 1 in 2 American adults over the age of 55 has high blood pressure. Let that sink in. We're not talking about some rare, isolated condition here. We're talking about an extraordinary, widespread epidemic that has, kind of tragically, just become normal. And because it's so incredibly common, we've vastly oversimplified how we treat it.
So we absolutely have to shift our focus here. The old view focuses almost entirely on the water pressure, basically just reducing your fluid volume and heart rate. But think about an old garden hose that's been sitting out in the sun for 20 years. It's cracked, it's stiff, it's brittle. If you turn on the water, even at a totally normal, safe pressure, that old stiff hose is going to strain and leak. The real problem isn't just the water pressure flowing through the hose, it's the cracked, stiff, and brittle garden hose itself. Your arterial walls are literally losing their flexibility and structural integrity.
Moving right along to Section 2, the invisible artery lining, also known as the vascular endothelium.
So, inside every single blood vessel in your entire body, there is this extraordinary structure. It's called the endothelial surface layer, or ESL. Think of the ESL kind of like a healthy riverbank that's protected by deep roots and lush vegetation. It is a brilliant biological sensor and communicator. It constantly senses the blood flow washing over it and tells your blood vessels exactly what they need to do. And how exactly does it communicate? Well, through a tiny little miracle called nitric oxide. This tiny gas molecule acts as a crucial messenger. When the protective lining senses blood flow, it releases nitric oxide, which immediately instructs the surrounding muscle cells to relax and expand. This tiny molecule is literally the absolute key to making your vessels flexible enough to cushion the impact of each and every heartbeat. But unfortunately, most of us are unknowingly destroying this beautiful system. Let's break down the 3 massive forces that gradually strip away your protective lining. First up, spiking blood sugar. Even just repeatedly jumping above 140 milligrams per deciliter after meals triggers something called glycation. Think of this like rust forming on metal. Sugar literally sticks to and degrades the delicate proteins of your lining. Second, chronic low-grade inflammation. This acts like sandpaper continuously scraping the inside of your vessels. And third, oxidative stress, where rogue free radicals attack the cells, much like oxygen attacks and corrodes exposed metal. Over the years, these 3 silent destroyers leave your vessels totally bare and vulnerable to plaque and calcification.
Which brings us to Section 3, the missing magnesium epidemic. This is the biological brake on constriction.
45%, almost half the population is walking around right now with this invisible mineral deficiency. Let's think about why that matters. Your arterial walls are lined with smooth muscle cells that need to rhythmically relax and contract, right? Well, magnesium is the literal cellular key that unlocks those muscle cells and allows them to relax. When you don't have enough of it, your vessels stay stuck in a state of chronic tight constriction. And here is the deeply tragic irony of modern medicine. The very medications prescribed to older adults are often acting as hidden magnesium thieves. For instance, diuretics literally flush magnesium out through the kidneys. Proton pump inhibitors, for acid reflux, they reduce your body's ability to absorb it over time. And chronic stress promotes rapid magnesium excretion. So common medications for seniors are actively flushing out the exact mineral your arteries desperately need to stay supple and relaxed. It's a tough cycle.
Let's move to Section 4, the stress-vessel connection. And we're going way beyond just telling you to relax.
Because chronic quiet stress isn't just some flimsy lifestyle footnote. It is a hard, documented cellular mechanism. When you are chronically stressed out, your body is flooded with cortisol. And this excess cortisol actively suppresses your nitric oxide production, meaning your vessels physically can't relax. It also signals your kidneys to desperately hold on to sodium and water, which drives up the volume and pressure. And, maybe worst of all, it accelerates the physical stiffening of your arteries. Stress is physically aging your arteries and locking them in a permanently constricted state.
All right, here's where we take action. Section 5, the 4-step repair protocol. These are biologically backed action steps.
Now, before we dive in, please note, this isn't magically replace your medication. Rather, it works on the underlying damage that your medication simply wasn't designed to fix in the first place. Step 1 is all about protecting that vascular lining we talked about earlier. To stop those 3 destroyers, sugar, inflammation, and oxidative stress, we use practical everyday tools. For example, a 10-minute walk right after your largest meal actually uses your muscles as a glucose sink, which can blunt sugar spikes by up to 30%. Add in potent anti-inflammatory foods like omega-3s from wild salmon and extra virgin olive oil. And to fight oxidative stress, a cup of anthocyanin-rich berries daily and a small square of dark chocolate, 70% cacao or higher. And no, I'm not kidding, that chocolate is actually a biological prescription here to help your vessels heal.
For Step 2, restoring your magnesium levels, the specific form you take matters immensely. You want to aim for about 300 to 400 milligrams daily, split between morning and night, but you must look for highly bioavailable forms like magnesium glycinate or malate. Do yourself a favor and absolutely avoid magnesium oxide. It's cheap, but it's really poorly absorbed by your body. And a quick, important caution here. Your kidneys actually regulate magnesium, so always consult your doctor first if you have any history of kidney disease.
Okay, step 3 is rebuilding your nitric oxide system. You can easily use dietary precursors like beet juice. Just 200 to 300 milliliters a day has actually been shown to lower systolic pressure by 4 to 10 points. That's huge. You can also add in leafy greens like arugula, spinach, and celery. But okay, here is the most fascinating, bizarrely effective part of all of this. Your nasal passages are essentially a factory for nitric oxide. Doing just 5 minutes of nasal breathing with humming on the exhale creates these micro vibrations that amplify your nitric oxide production by up to 6 times. How cool is that?
And finally, Step 4 is a structured clinical intervention for stress. And I promise, this isn't just me saying, hey, try to relax. This is a hard physiological reset. By simply breathing in slowly through your nose for 5 seconds, holding for 1 second, and breathing out slowly through your nose for 5 seconds, and doing that for just 10 minutes a day, you literally force your nervous system into a parasympathetic, resting state. Clinical data actually shows this exact structured protocol can measurably drop your systolic pressure by 6 to 8 points over time. It is actively combating that nasty cortisol damage.
So, if you remember absolutely nothing else from everything we've covered today, let it be this quote right here. A bridge is not a destination. Repair the damage. Your standard blood pressure medication is a fantastic, vital bridge to keep you safe from a stroke or a heart attack today. But a bridge is not where you're meant to live. Your true destination is a fully repaired, resilient cardiovascular system. A healed lining, relaxed, smooth muscles, and a robust, functioning nitric oxide system. I want to leave you with this final provocative thought. You're armed with the knowledge now, and no, you don't have to change your entire life overnight. But looking at the 4 steps we just covered, the post-meal walk, the highly absorbed magnesium, the beet juice and humming, or the structured breathing, which single step will you choose to start reclaiming your cellular health today? Just pick one, start today, and take control of your engine. Thanks so much for learning with me, and I'll catch you in the next explainer.